Good day, class. Good day, class. You're welcome to our today's lecture. We are still on the course, please. We are still on the course 201. Year 201. Where exactly where exactly did we stop? Have we done have we done the targeted? Yes. Right? Have we done that? Let me please notice. Sorry. Share with you. Please, let me keep my feet here. Please, I need to see something in the Telegram. Are you on the Telegram? All right. Okay. Okay. We start from the health education what? Set what? At least if not from the point of view of your literature, literature in your scenario set scenario different different places. Maybe if you are talking about a particular concept, how it is done in this particular area, how it is done in this particular American congregating. So you can have different settings for a particular concept. American congregating. You know, here now we are talking about what primary healthcare. So we can describe primary healthcare, health education in different settings. In the hospital, what happens and how it is delivered in schools, in community setting. What's going on? What's going on? Losing my voice. Thank you. Is that what I did Okay, now, so let's look at education settings in clinical what settings at different places. We are education can be what delivered. Okay, you can see in clinical settings, even in hospitals. Some some of you have gone for antenatal, right? I said so. Some of you, you said no. This is seen in what clinical, hospital, name them, maternity, all those things. Even what? The three of us. Anytime. Okay. We also have in community what centers. Community what centers. You see people, maybe a group of health workers may come around. Maybe they go to the community leader that they came for one or two things. Maybe sometimes they will they can't with the what because it's around the village, right? You not tell them good. Even if they go to some start telling them about their what, and they appreciate it. And they appreciate it. Start telling them you not charge them anything, you no charge you just to go and just do things. Some you just what you are doing, they just get envelope, fat envelope, and give you in appreciation. You gotta be like, how come difference from nowhere just no that you just come and seek permission and sit students down and start talking to them about their health and some certain things. So no, because of what health what education. Am I communicating? It's also then what is too. So some of their what staff once in a while those are resource persons. We have platforms. That one is common now. Three of us.
That one is to them, please double check whatever information you are seeing online. Okay, that one is even more dangerous, but there are some there are some those that are saying are not, I can't, you can't even do it, but they are saying it. Some are saying it because they heard from somewhere, from somebody, and they are saying. Some are saying it because they truly they want to help out. Maybe there's some are well informed too. Like that time they say everybody should do salt. There will be sickness. Some are well informed anyway. Some are giving out. If they tell you, they give you references on how where you can source the information. It's okay, but there are also some that are just doing it because they think that once there are key things that if you talk about, people will listen to you on the internet. Once they start talking about things that have to do with religion, people will listen. It's especially like if it concerns their own what religion. Then if you start talking about things that have to do with health, people will have to do what? Listen. So they see it as a way to get what? Engagements, followers. So as you are listening, please be careful. Then we also have public health what? Departments in different what? Establishments, or even in the government. I'm not competing. They can go around, talk to people about their health. Are we together? They do it. Are we together? Then we also have profit deals, right? Non-profit, non-governmental what? Okay, so there are many of them. There are many of them that go around, telling people. In fact, if you have what it takes to do all this, you can raise it up and also help to do what? Promote health. It's a good thing. Are we together? It's a good thing. So you see them, this all these things you are seeing, all these things I've been calling, they gear towards what? They gear towards what? Health what? They are under what? Health what? Education in different what? Setting. The objective is to do what? Promote health. Am I communicating? Are we together? Good. So effective health education was very, very essential for promoting what? Healthy what? Behaviors, preventing what? Diseases, people are all well-being. In fact, that is the key, because through that, even you self, even with your level of, at least level of exposure in the health line, in healthcare system, every day, the more you search for information concerning your health, or listening to health talks on you the more you realize that there are some things you didn't even know about your health. True of us. So it is non-stop, it's continuous. You keep learning every day. You keep learning what? Every day you keep learning. Now, can I put my finger? So now, let's go to assumptions of health. What? All this is we are just talking about defining. We just define health education and say one or two things under what? Health education. Now let's go into what? Assumptions of what? Health what? Health education is based on system, but is that all these things they gear towards what? Promote health what? Comes. Assumption all of them together gears towards what? Promoting what? Healthy what? So what are these assumptions? Let's look at the rest of put in sum, I said to put references. You are at your free, because this is not second. So I want to gradually introduce you to what it means to do what, carry out research on your own. On your own, you can look up all these things. So some of them are published journal articles. You can get the from the references and they look it up and do what, develop yourself in that area. Am I do it? I will remain in one subtopic. This semester will do what? End. Except to be adding some, so that you your if you get any of these references and take it to the journal articles, you can read more of each of things. I'm not communicating because I know that many of you are interested in what research, right? I can see it in your eyes. Alright, so cognition, what comes to your mind? Okay, so cognitive what? This assumption state that people are what? That we have the capacity to do what? Learn and do what? Understand what? Help what? Information. So that's why we gather people and educate them. True of us, because we have the belief, the assumption is there that once you talk to people about or give the people information about their health, they will do what? Understand it. People, why can company come here to teach you this? Is because I have the assumption. Do you know why it's assumption? Because it raises some of you may not even have interest. Some may even be here, but they are somewhere else. True of us. But before coming here, before even employing me, before even sitting you down here, there is assumption that you have for you to get to this level, you should understand. It's an assumption. I hope you know. You should understand what it is. But if you on the other hand assume that somebody going, they will not what understand. I will so that these are have the capacity to do what? Learn and what? Understand how to what? Information. At all. To the so now what? Assumption. Now, having learned about your health, the people having learned about their health will be motivated, right? Yeah. To do what? Having talking to you or giving you the information about your health, you will say, now let me start doing well. Is that a motivation? So, but if I have the assumption on the other way that even if you talk from now to tomorrow, we will not talk about so that's what we call it what? Motivational what? To have and do this one, environmental what? That the environment health. We've been talking about this, it's true of us, without knowing that we are talking about an assumption. But we are talking about it that the environment influences your what? Health behavior. So the environment influences health behaviors and modification. Modification 2016. is what? Environmental what? Then the next one is that people believe in what ability health promotes. That's how, if I speak to you is well. Please don't allow, even though but let us not allow it to beat us. If he comes, stand up, say no, you cannot. Because a very important that people believe in their ability to do what? Perform health what? Do what? Behavior. You say, and they get it right. Ability to do what? To say, taught me this. I can do this. Two of us. And now because the person, the educator will not be there always. Two of us. Two of us. Yes. So you have the ability to do what? To do what? To perform. To what? Can you give me an example of health promoting behaviors?
Washing of hands.
God bless you. God bless you. Washing of your what? Health. Next one. Okay, good. Even though your environment influence, maybe the influence is the negative one, that you are in a dirty environment, right? You have what it takes to modify it, right? By doing what? Sanitation, right? Good. Will you say because I found myself in this environment that is not influencing my head, that is not positively influencing my head, you not say, hey, this environment does not influence my head. What do we now do? Now start looking for a way to do what? Influence our health. And then that is from Bandura 1997. The next one is social support assumption. Support assumption. Social assumes that social support from family, friends, and community enhances what? Health behavior adoption. True of us? Yes. See, we have discussed most of these things, but we call it came from. True of us? I don't really discuss, but we didn't specify where they came from. So I'm just telling you now that this is the full all the assumptions. Am I communicating? Now, so when we are 15, that's what this one let us know that the what cultural population, cultural and basic needs of what population in question. If you like talk in as much as yes, we want to promote this group of people, you need to be cultural what sensitive. Don't be sensitive to your own. Don't be insensitive, because look for how you can still help them live healthy by promoting the health in line with what is acceptable in that particular what area. You can still make it. You must not be too ideal that you forget to be rare. Looking at what is on ground, because if you like speak grammar, After speaking grammar, you go home. They will continue. So what is available in another place is very important. You put it into what?
So that their faith is matter, which is for promoting the health.
You know, for ages, for ages, find out why they are surviving. That's what serious. It's not just what you just do anyhow. You carry where you came from, doing like that. There's something what out from the soul of earth. Am I communicating? Am I communicating? For ages, that thing became so. Because of that reason to survive, start from there. But even with time, gradually, those on you have in your mind from where you came from, you forget. I want to impose on them that if you the kind of resistance, now some people once they see someone like you again, don't even come again, don't even come. Remember they will come from their home to listen to you too. So you need to be sensitive, find out if what they are doing is totally wrong. They would have been walked away now. So why have not been? There are some they are not really you think is yourself. They even look at that one or two for what I do, and now modify it to look better. And you grab one or two things, I think to where you came from.
I don't know. There is this case of like some lots of
Okay.
about
Yeah.
of the family children in excess and all that. So of course the husbands were against it and everybody were but some women and maybe some mother-in-law were able to take their daughters-in-laws to meet the health workers. So they were not like, okay, what kind of company can they do that their husbands will not find out that they actually did something.
Yeah. Okay.
So with that, I think they now administered injections to them that okay, with that they don't even know what they did. So I don't know if that is an example of cultural sensitivity as well.
You know, they believe. Listen. You see them having so many children. The two they like, they like to just to marry up and down. Believe that even in some cultures, even in southeastern part of the country, those days, they believe that you see, because they need. If you marry many wives, then you can have people that have more hands that will work in the farm yard and get more. You have more yam, more harvest. Two of us. That's their belief, and it's working for them. It was working for them. But nowadays, because now that Christianity came in, started what? With time, In fact, if you even marry two wives now, they look at charisma. What's wrong with me? Am I competing? But it took time. It took what? Time. So now, that majority of what's done there is belief too. It's also what? Belief that they need more, they need more to give birth to many what? Am I competing? So maybe, remember, so some may be physically engineered, hope you know, some, depending. But basically, it also majorities has cultural underworld too. And coming from where from your question now, believe I can put it there, even though not all of them. Some are just careless. Some are just let's just keep doing anyhow. Some are like that. The more there is this advantage of having big what family. Am I competing? Yeah, there are some like that. But there are some that are just because they see others are having, they just have. Am I competing? So now, what they did there, the point is that their mission was what? There was an agreement. True of us, yes. That the mother-in-law started on their own, as you said now, bringing their on their own. They didn't force. There was all true of us, yes. But before them, they were sensitive of where they came to. They didn't just impose it on them, call whatever that they are doing nonsense. If you do it, they won't even come again safe. First of all, you must accept what you meet on ground. Then you now start talking about what the disadvantages of what they are practicing. Not that you are condemning it. You start looking, even though yes, in your mind you know is nonsense, but you cannot just talk like that or give the body language. It's nonsense. Am I communicating? But in all, you have what you want to achieve in your mind. But with good approach, you make them see reasons why they should do this, and that's why they could do that on their own, even without letting the husbands know. Am I communicating? Good. There must be element of that. Say you must. In fact, before you even go there, they know what they are going to do. You can even plan on how to convince them to achieve their what purpose. Then empowerment what? Assumption that health education empowers what? Individuals to take control of their what? Health. The purpose of educating you health wise is to empower you, right? So you can take charge of your what? Are you aware that some people are not in control of their health? Are you aware? Anyway, anything they see, anyone, anyhow they are available. Anything goes. Anything does what? Goes. Education is powerful. You see education powerful. As she is now, I want to tell you how powerful education is. As she is now, are you aware that I can, as she is now, or any other person, you can be isolated in a particular training or something, either negative or positive. Out how important it is that any just cut his head. Any man you see cut his head up. Are you aware? that without education, series of brainwashing. I call it brainwashing. Are you aware that this person here that you know that is now okay? Such are you aware? Yes. I'm trying to point out how powerful education is. How powerful education is. It's a strong tool to make or mar. If you get it right, the society will be what? In order. If you get it wrong, some of these people you see that they are, you see, really, how somebody just come out, you just to be kidnapping people, killing people. Education. Somebody or a group must have educated them. They may come with one concept that is funny. I keep telling you that people be like, doesn't this person have sense again? No, it's education. That's why you go for the right what? Education. The person that happen to society is when you have the wrong what? Education. So now breaking it to health now. This is how important health education is. With formal education, this if not for the proper education, to prevent of COVID-19, if not with education, by now, do you know how many people would have died? Even if there was no education on how to keep yourself, by now, do you know how many people would have died of what? HIV. Am I even the drug that you give to the patient, you need proper what? Education on how to do what? If not, problem, even the drugs. Health education important. Now, next one is what? Participatory what? Assumption. Yeah, this one pointed at the active participation in health education increases what? Effectiveness. Active participation in health education increases its effectiveness. Active or gas go let me go back to my farm, or talk about let me continue my life. Whatever you are told to do, do what? You do it. Take it what? Seriously. Participate in whatever, because you are a bit of not to hear and go home. That's all we can take. We have references there. I quoted some people here. At usual time, if you have interest in health education, we have enough reference materials. Google it. Go to the see the article, study, and develop it. I say, what's there? Ask. Is that your problem? Clam. Hey. Say clam.
You are being taught to know.
You say crab. I will not answer that question. I will not do what? Answer you that question. Sorry. It's there for you for your further words research. By the time yourself, see, if truly you make out time to look up for all those things and grab one two things there, you see yourself quoting themselves, two of us, because you have done what? You have read, you have gone through them. You see yourself quoting it. According to so person, right? You see yourself quoting it. You don't you don't cram it. You don't do what? Cram it. How many are you to cram? There are millions of them. Cram them. But if you truly take it serious and research and yourself, you see yourself to so person. So you quoting the top of the article without even knowing, because you have done what? Research. So it's that answer that question. At this level, we are in whatever school. So let's look at it cannot be on. You can't. Okay, you've not gone online today. The new ones I posted to principles of what? Health, what? Education. I think I have this one here. Principles of what? Health, education. Principles of health, education. So are we together? Let us come on under 9 minutes. Please, next time. If I saw today, I'm not happy about that. Almost the class was almost empty, and I couldn't just start. That's why I waited. I'll not do it again. If I come in here next time, please know the time. This is not a fixed lecture. Is it a fixed lecture? Is it a fixed lecture? Did I just fix class with people? No. It's not a how would you be a class for a lecture? Don't tell me you went to eat. That is not an excuse. It's not an excuse, right? It's not. It's not about planning yourself. It's not. It can never be an excuse. Next time if I enter your class, I want you to come in. That it doesn't make sense. It doesn't hold at all. Maybe you are here and you feel pressed. Of course, you cannot poop here or urinate here, right? That one is a different. We all what I saw I just stayed quiet and waited for you. Please let it not happen. Now, because of what? Health education. What are they are what? That do what? Help what? Educators design and implement health education programs. Education that help health educators design and implement effective what? Health education what? Program. So these principles are based on the framework research. Best practices in health what? Education. Based on what again? Research. And what is best practices in political framework, active research on the field, and the practice. That what you gather from real practice. I have another new student here. You said no. What's that? Listen now. Who can help us? What is theoretical framework? Help us. Help us.
Then Pastor.
Jeva who?
Also.
So yeah. Let's start by the term theoretical framework. Those that have done research here before, those that have graduated in one course or the other, they actually did research. The keyword theory.
I think that okay. This area because they all live in fine houses, but it may not necessarily be so. Some might not be living up to the pay grade you think, maybe they are just that way. So it's just an assumption because you are saying that actually everybody are paying their rent of 1 million naira a year. Everybody here they are telling they are very 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 rich, but that may just be an assumption. There might still be few that may not fall in that grade. So coming to health education, you might feel that everybody here they have an idea of what causes measles now, but not everybody may know.
And it may lead to even more research or even experiments to find out. Other factors that is not contribute to that. Yes. Are you with us?
Yes, sir.
Are you sure? My new students. She says she's not my new student. No. And if I'm seeing for the first time, you're my new student.
Yes, sir.
Have you met before? No. She said no. So she's my new student. Let's continue. Now, keep look at them, and we have 3 minutes to do that. Let's look at them. Key principles. One is what? Participant-centered what? Approach. Participant what? Centered what? This one from what? Needs, interest, and concern of the world. Yes. Upon this now, upon this, remember we are talking about what is guiding, what we have to prepare for the what? Education of us. Now, is a participant central approach. This one has a lot to do with what? Look at the needs. This one are the needs of the learner. The interest and concern can form a basis. The basis for what? Education. Am I communicating? Am I communicating? Good. If you know, then maybe let me take here now as what? The learners, right? Those that need one education. Maybe having come here now, I now realize that you need where your interest lies as regards health and your interest, your need. It may help me to, as an educator, to develop a program that will help for what? To educating you in that what area. Am I communicating? So that what you mean by what? Participant what? Centered what? Approach. This from no what can someone this? Someone say no less. Okay now. No, right? There's a celebrity that has this name? Who is that? Beyonce. Good. Her name is what? Good. This lady is informed. Is what? Informed. Be informed. Be versatile. But don't deviate from your primary what? Purpose. But be versatile. It will help you. So that is 1984. He says that what? That the participant-centered approach focused on the needs, interests, and the concerns of the what? Learner. Okay, now. The next one is holistic what approach. This one we just focus. This one just general. We just bring everything, address everything that has to do with what social, physical, and what everything aspect of health is holistic. Is what holistic is holistic. According to what WHO 2011, WHO 2011. Based on this, now you see, even you see the WHO, maybe that nothing serious happening. No, they just talk about holistic health care, holistic health education, so that if you see it any aspect that concerns you, you focus on that. Am I completing? Any aspect that concerns you, you do what? You focus on that. If sometimes maybe you see who amongst you follow up WHO publications, who among you follow up the WHO publications, it's very interesting. Try as much as possible to check their website once in a while, see what's going on to help you to grow in this area. Am I concreting? You know what they bring out? They bring out guidelines, publication on a lot of issues. Am I concreting? Good. Then we also have what? Cultural what? Sensitivity, respect for diverse what? Values, beliefs and practices. Beliefs and what? Practices. This also will inform you on how to design any program you want to design. Are you aware? Are you aware? Sensitive, being cultural sensitive of those you are what talking to. We cannot say that we have talked too much about this. We keep what saying it because you meet it. It's very important to know it's very important to understand that. If you are culturally sensitive, it will help you in preparing any program you want to prepare for a particular what people. True of us, yes, it will form a principle upon which you will know exactly what you are doing. Hello, have we met before? Have we seen it before? Huh? In this class? Are you sure? You look like a new student. Alright, let's continue. Are we together? Good. So there are many of them. There are many principles. We have empowerment, we have inclusivity. These things are self-worth. They are self-worth, explanatory. We have relative and what? Accurate what? Information. Of course, you talk of course now, whatever you are going to give, you need to be up to date. True of us, up to what? Up to what? Dates. Up to what? Dates. Up to what? Dates. You cannot just come because you think you are talking to people that are not informed. You start giving a cake information that no. Before you prepare, you sit down, ensure that whatever you are going to give is up to what? Date what? Information. Am I completing? It is very important. These are things you also consider while preparing what? Any education program you want to give to people. Am I completing? I can remember that there's one day I have always known. I know that as those in health, those in what is it called? As clinicians, I know we have public health pharmacy too. Public health, up to date information concerning what drugs that has to do with what not control drugs. So even telling people about drug abuse is also in that line. Two of us, good. Now, what was that again? As at that time, the information I had, which I didn't follow up, was like Atemta Lumefantrine is not used in the first trimester. It's used from second trimester. So, but when the person was telling me it can be used to first, I was well because I know that these things are updated on regular. I didn't argue. But my facial expression told it all. But I didn't argue because I said, yeah, okay. Immediately after that conversation, I went. I said, wow. So now we can, so it's also a kind of is only. Do I use the word? No, fool is too harsh. It's only someone that's big that don't want to grow, argue. Science evolve. Do not put your mouth and tell somebody you are wrong. Don't do that. So far science is concerned, even I do it to my students. Some have the courage because they don't do what? Study. You know, say, sir, please, can you tell me your source? That's simple what? Question. Not you are wrong.
Yes.
Don't say that. You may be saying something and somebody is saying another thing. Tell the person, just simple question. Please, let me know your source. This is my own source. Please, let me know the source of your information. Then if the person cannot, who? Where is it? In his office. Okay. So if the person cannot give you the source of his own information, simply tell the person, please go and study more. You have said it all. Politely, you have said it all. You don't need to tell the person you don't know what you are saying. No. Please do more research. Because the person has no point. Am I communicating? Yes. So immediately I said, okay. I immediately after that conversation, I went and I started a session, and I realized that the person was actually what? Right. Am I communicating? Yes. I say, wow. I learned that one too, and put it in my own words, library. Yes. Of what? Information. Am I communicating? This is how you learn. Don't argue. You don't necessarily arguing. It's not what necessary. And my students know me for that. Please give me your source. Most of them you just sit down. So I'll tell you, my brother. I say you're not serious. Your brother too. Who is your brother? Is your brother an authority in the field? Even if your brother is authority in the field, please give me the link of his publication, of his article, of his published article in a recognized international journal. If you give me that thing, then I'll go and read your brother's work. Two of us. But none of that my brother told me the mouth, you are wasting your time. Am I communicating? So please, you have to give updated what? Up to date what? Information. Very, very what? Important. So I think other ones are just they are easy to understand. We've talked about collaboration here, right? So it's not a new thing for us. We talk about continuity, right? We talk about continuity, right? So it's not new either, right? So please, in our next class, we look at what? Factors affecting health what? Factors that promote what? Effective health what? Education. So please prepare yourself. I will step out now. My attention is needed in the office. So just prepare yourself. Once I'm done, I'm back. We will write our quiz. Once I'm back from the office, we'll write our quiz. My attention is not there. You're just coming now, child. Alright, thank you very much for your attention. See you when I come back. God bless you.